So now we're going to talk about scanning in a transverse plane. So there will be two views in a transverse plane, and again, the one in the red color are the two most important views that you want to focus on. So transverse spinous process view. This view, the transducer is right on top of the spinous process. And the spinous process is a bony structure, so it will block your ultrasound beam from penetrating deeper structure. So you won't see a whole lot in this view. So here we have a traffic cone sign. So you see the spinous process in the middle and your lamina. So you won't see a whole lot down here, just your spinous process. But the good thing about this view is it's very reliable. Even on super obese patient, you may have a hard time obtaining other view, but you will always be able to obtain this view. So at the very least, when you do ultrasound, you're gonna know your midline. So now we look at the when you at the spinous process. Now you wanna either slide your transducer downward or upward, so that way you can look through the spinal canal, your interspace in the spinal canal. And the image pattern for this view gonna be your bat wing side. Here be your posterior complex. Your posterior complex is going to be a little bit harder to see in this view comparing to parasagittal oblique. Anterior complex, transverse process. One thing I want to point out though is if you have a hard time visualizing your posterior complex, you can use your transverse process as a guesstimate for your distance to your posterior complex or your ligamentum flavum as well. Articular process. So let's look at an image over here. Posterior complex, anterior complex, transverse process, articular process. So what can you do in this view? Again, this is a very important view. You can identify your midline, and then if you note the angle of your transducer that bring you this view, that's going to be the same angle you use for your needle as well. And again, you can measure the distance from the skin to the posterior complex. But then again, sometimes it's hard to see the posterior complex in this view, so the parasagittal oblique is a better view to measure your ligamentum flavum. But this is a second way you can confirm or verify your distance to ligamentum flavum. And again, sometimes if you have trouble visualizing your posterior complex, you can oftentimes still see your transverse process, and that still correlate pretty well with your posterior complex as well. And you want to try to obtain this view at multiple level, and at whatever level that you can achieve the best image, that should be your first choice for placing the spinal epidural. So in a way, this view can let you decide to pick the optimal space as well. How to identify rotation in scoliosis. So when you put the transducer in a transverse plane on the patient, you're gonna have this normal looking symmetrical picture. But for a reason, you see some rotation. Your image kind of tilted a little bit. So that tells your patient have some degree of scoliosis. And when that happens, you want to rotate your transducer as well to bring your image back to a symmetrical, normal position. And this new position of your transducer is going to be the angle of your needle as well. So now we're going to look at a video that I recorded. So we're going to use a low frequency wide transducer, start a couple of centimeters from the midline, try to find your transverse process using your trident sign. There we go. Here's my trident sign. Now move medially, try to find articular process. You're looking for the camel hump sign, and here your articular process. Now stay where you are except tilting toward the midline to obtain your parasagittal oblique. Alright, that's the deeper line right here, that's the anterior complex. Up here is hard to see, but you see another line more superficial. That's gonna be your posterior complex. You look at the rule over here, is at about 5 centimeters. That's gonna be your distance to your ligamentum flavum. Here's your lamina. Here's your lamina. In the middle of these two lamina, your interspace, you want to center them in the middle of the screen and mark your interspace. So maintain the same view parasagittal oblique, but slide downward. Try to find my L5S1 interspace. Line them up in the middle so it match up with the middle line of my transducer and mark it. So this will be my L5S1 interspace, and then keep sliding up, repeat the same process. So identify my L4, L5 interspace, and then next gonna be my L3, L4 interspace. This is important because now I know my interspace. Was in case I couldn't obtain my bat wing sign, a transverse interspinous process view, then at least I know my interspace. Also, when you rotate 90 degrees to a transverse plane, it's very difficult to know what interspace you're looking at. So here you know exactly what interspace you're looking at. And if my marking is accurate, I should be looking at the interspace. I should not be looking at the spinous process. But sometimes, the patient move for various reasons. You turn the transducer 90 degrees and you look in the spinous process. If that's the case, then just slide up and down, try to find interspace. Some tilting may help as well. And here, trying to look for my bat wing side. That's my bat wing side. Up here is my posterior complex. It's correlate to about the same 5 centimeter. Here's my articular process, transverse process, anterior complex. Alright, so now I'm gonna mark the entry point of my needle. So I'm gonna mark the midpoint of the short edge of my transducer and the midpoint of my long edge of my transducer. So I'm just trying to show you here. I'm not doing it because there's so much gel. So instead I'm doing something a little bit different. So I'm using the back of my needle. So that is the midline and my interspace. The spot I just marked with my needle. That's going to be the entry point for your needle. And now I'm repeating the same process at different interspace. Again, try to find my bat wing side. As I see it's my bat wing side here. Then I'm going to repeat the same process. Mark the midline and interspace. That's my needle entry point. And then you can repeat the same thing for another interspace, but I choose to stop here. Now just wipe up the gel and proceed to do your epidural like you normally do, except this time you know your midline, you know your interspace, you know it's 5 centimeters to get to the ligamentum flavum.